There was a study done here in Minnesota a little while ago called Somali Immigrant Women in the American Healthcare System, Discordant Beliefs, Divergent Expectations, and Silent Worries. And this study really sets a tone here for what our Somali families are dealing with, and specifically our Somali women are dealing with. There are belief systems that are set that we want to understand in order to support and help these women find optimal health, right? So in this study, they identified that there was contrasting understanding or contrasting beliefs about Western medicine and traditional medicine that a Somali woman might be more comfortable with. And that contrasting belief was getting in the way of them getting the support and health care they needed and deserved through our healthcare system. I want to read something here that's important. These discordant health beliefs resulted in divergent expectations regarding treatment and healthcare interactions. Experiencing unmet expectations, Somali women and their healthcare providers reported multiple frustrations, which often diminished perceived quality of healthcare. So this was a really big deal. If we aren't aligned with our healthcare professionals, we're not going to go back, and we're not going to go for the preventative care checkups and all of those things. So this is important information to understand. Moreover, silent worries about mental health and reproductive decision-making surfaced. To provide high-quality transcultural healthcare, providers must encourage patients to voice their own health explanations, expectations, and worries. So a lot of what this program works with is just that. It's creating an environment and a space for this to happen here. And so that when the woman gets to her health professional, she feels stronger, she feels more in control, and being able to voice her concerns up front. And there were three other things they mentioned that were about how a Somali woman viewed health. That was being engaged in productive activities, relating well to self, family, and Allah, living in communities that watch our children and avoid violence. Those were the three most important things. So knowing this, this program really circles around that kind of, that love and that support, and acknowledges that as being very important. It's the key. It's not top down. This isn't, I have information and I'm all that and I know what I know and you should know it too. I don't know what you need to know. But in the circle, we're able to understand a little bit about each other so that we can find the healing. So there are many, many assets within the Somali community and strengths that really come to the table here when we work in this program. Based on the report done in the Cedar Riverside area, they identified a few strong value on health. Traditional practices of healthy eating and leading a healthy lifestyle is extremely important. Traditional foods and medicines are used to prevent and treat illness. So these are things that already are embedded in the community and in the culture, so we build on those. Religious and cultural practices order the daily lives of Somali people. This structure is something that we, can bring in the knowledge of food. It's just aligning it with this structure and with these beliefs as well. Somalis are also highly interconnected and gather frequently. This idea of a circle is not new. We have always met in circles and groups of people. The piazzas in Italy, the courtyards, we come together and we meet and we spend time and we share. So this is already built into the Somali culture, and we just build on that. Oral traditions for sharing information are prominent. This is an interesting one because I'm all about, often notes and information, and here's a handout. It's not necessarily what works here, but the information that we deliver can be taken and then passed on. And this is huge because I see it with the kids who are watching from a distance, and then the parents sharing that information and, here, take a bite of broccoli. You might like this, or here's some information you might want to know about reading labels to their child. To understand where the Somali woman is coming from, we can then build on that strength and those assets, and we have an exchange of information and sharing. Go to the people, live among them, learn from them, love them, start with what they know, and build on what they have.